There you go.
And thank you. And glad to be back and to offer, you know, just to keep you guys informed on where we're at with our school division and moving forward. As most of you probably are aware that we made note at our last board meeting that we would be moving to 4 days a week for our secondary students starting on March 15th. And a lot of that is, our goal has always been to try to get our students back in school. When we set our plan early in August, unfortunately, we didn't have the foresight for some things because we were early on in the pandemic, and it was the first time doing it. And you're trying to prepare to have foresight to continue to add days as you can. But unfortunately, we had to adjust start times for a couple of elementary schools, so that would free up buses to make sure that we could get one student per bus. But as we've worked through this pandemic, our school system has really kind of been the leader in our area when it comes to showing how we can get students in school and do it safely. Our elementary schools have been going 4 days a week since September 8th. We have not had any transmission in our elementary schools or any of our schools that we are currently aware of. Um, you know, because of the mitigation strategies that we have in place. But there's also a couple of things that, when we take this into consideration, we always have to, our concern is the health and safety of our community. And so with new CDC guideline updates, new regulations from the Virginia Department of Health and the governor's order, along with new guidance from the Virginia Department of Education, things are changing every day, and we knew going into this that in the virtual world there was going to be a learning gap, and we knew that's just the nature of the beast when it comes to virtual education. There's a slight learning gap compared to the direct classroom instruction. um, but we have also seen a lot of other things happening within our families and within our students, that concerned us. And I don't know if I share my screen.
Yes, you can, as soon as I make you a co-host. There
Okay.
you go. You should be able to.
All right. So, um, all right. I think maybe I'm sharing.
You are indeed.
All right. So, this was at one of our superintendent's meetings with Dr. Lane. The Virginia chapter of the American Academy of Pediatrics delivered some information to us. And Dr. Martin, Dr. Powell, and Dr. Rowland really did a good job in their presentation. And they they actually presented on why is in-person school important. And of course, as educators, we knew, but it's education, it's a safe place, socialization, warmth, early intervention of food. But really, when you get into the meat of this, you know, one of the things that they said that when we look at, do we go back virtual, do we go back in person, increase days, how do we handle this? Basically, it's a risk benefits, when you look at that. And through mitigation, can we address the risks so that we can have the benefits to our students? So, what are pediatricians across Virginia seeing right now? And and we're seeing some of these things in our school system, but an increase in mental health disorders, suicidal ideations, teen alcohol and drug use, um, eating disorders, obesity, uh, equity gaps. So so they're seeing a lot of these things that are going on within the community. And actually, Dr. Martin, who's the president of the Virginia chapter, he made note. He said, typically, He said, I had last week six students that there were situations that I dealt with them that typically in a normal year, I would get one every 6 months. But he said, on average, I'm getting about 3 a week. Now, his practice is in Fairfax. But, it's just not centered to our population centers. It's throughout the country from coast to coast when you look at students. So as we saw from some of the survey points that they provided, when you look at what are physicians saying, an increase in that and anxiety in students. So students that used to not have any anxiety problems about coming to school now are experiencing that. And that was a greatly increased response from the pediatricians, that they are starting to see more anxiety in students or children that they are seeing within their profession. Depression, that's another thing that has been an increase in something that the pediatricians are seeing. Suicidal ideations, yes, that's a slight increase there. We have more of an increase, but not a greatly increased response from the pediatricians. The one thing that we're going to be seeing for a long time is behavior problems. They said that due to the pandemic, they're seeing more behavior problems, just normal behavior problems, an increase in what they're seeing, and that's going to actually, we're going to see that in schools, not for just coming back, but years on down the road, because this pandemic has caused other issues to come about that are causing other behavior problems that students just really do not know how to handle. And of course, academic difficulties greatly increased. We knew that. Obesity, I mentioned some of that. So they really looked at some studies, the one in Wisconsin and one out of North Carolina. And when you look at these two studies, out of all of the studies, there was never any spread from that. There was one case, and Dr. Martin mentioned that there was one case in these studies where there was actual spread from student to teacher. Most of the spread that occurred that they identified is spread between adults, from adult to adult. Because why? Adults feel that sometimes I can relax on that mask if I'm in a room with somebody that I've taught across the hall with for 20 years, and I know them, I feel comfortable with them. So they relax in some of those mitigation strategies that keep them safe and that keep from spread occurring within the school. But out of everything, schools are the safest place. And in these studies, it also showed that a community could have high rates of spread within the community, but that was not one due to the school, but the school would have a lot lower rate due to the mitigation strategies that were put in place. Again, when spread did occur in the school, again, it was just lapse in masking, and one of the issues we had where we had a break room that was open, and so we had to quarantine quite a few people, because in the break room, even though they're distanced, everybody's taking off their mask and drinking their coffee together. Well, we know you can't drink coffee through a mask. We understand that. But when you're in there for an hour and you're all in an enclosed room, then that becomes the issue. And so we went around looking at some of those areas where groups would congregate and maybe feel relaxed about pulling down that mitigation strategy of the face covering. And so one thing I like really is when you look at this little diagram down here, how mitigation layers really just help in protecting, and what can we do to continue to protect. I thought that this slide here, showing how masking is critical and how it has worked in schools really is the telltale sign. So when you look at this, and I don't know how clear it is on your screen, when both people are wearing a mask, even within a 3-foot distance, you have less than 0.5% of contracting COVID. If you're at 6 foot, you still have less than 0.5%. So masking, we know, is important in the schools, and that's why we've mandated masking, you know, to make sure that our students are safe, our teachers are safe, and that we do not have community spread within the school system. So really going through, this was just one of the studies, but the telltale sign of what's happening in communities, and I got to figure out how to stop sharing here. Okay, I think I did. How schools have been successful in order to make sure that our students are getting what they need. We know that we are having difficult situations with families and students with their education this year. We know that having students being put in front of a teacher is the best way for education. That live instruction is good instruction. And then we also know that when you look at community spread, it's not happening in the schools because of the mitigation strategy. It's not happening at the elementary schools because they're in 4 days a week. You know, we would see, if we look at some of our data, I can probably tell you that we've probably had a few higher cases at the high school, but that's because those students are in 1 day a week. So that means the rest of that time they're out, you know, they're out in the community, they're over at a friend's house, they're doing whatever. They're not in school from 8 o'clock to 1 o'clock or 8 o'clock to 3 o'clock. So they have time to go out and mingle and do whatever they want, even though they're supposed to be on a live meet. That's not always happening because we give our students the opportunity that, you know, if you need to go in later on, once you're recording to get the lesson done, as long as you get the lesson and you stay on task, then that's the main thing, you know, learn the content. So there's been some flexibility there, but really when it comes down to it, we need to do what's right for our community, for our students, because we're going to have difficulties, and we're working on remediation plans for how we're going to address this for next year, because we will plan on coming back in August 5 days a week on a normal schedule. I know there are a couple of Senate bills out there and House bills that are pushing schools in that direction, but our goal is we know how to handle this. We have done a good job. We've been a leader in the region and making sure that our students are protected, that our teachers are protected. You know, it's not a prerequisite according to the CDC, but 65% of our teaching population have been fully vaccinated. So that's another layer of protection for teachers when bringing students back. And I'm sure you guys are aware that with the new CDC guidance that if you're 10 days after your second vaccination, then you do not have to quarantine, just self-monitor. So that would really, you know, that's that extra layer of mitigation. And that one slide that had all those layers in place of it, vaccination was one of those layers that helps us in moving forward. So really, we know it's the best thing to do for our students. It's the right thing to do for our students. Our students need it. I can tell you that the high schools, when walking through those classrooms or walking around those halls just a couple of weeks ago, that I walked in a math class. I had a math teacher, I had an instructional assistant, and 3 students. We have the capacity, we have the ability within our classrooms to bring those people back in and to increase the number of students and not and still keep our distancing of 6 feet. Our goal is to stay with 6 feet. But also our studies have shown, studies that we've looked at, even the Virginia chapter of pediatricians mentioned that, hey, 3 feet is fine. Masking works. There's another study that I have that we looked at, and I shared this. I'll share my screen again real quick. Um, and I handed this out to my principals, but this was done by uh, this was handed out a couple weeks ago by the CDC. But really, when you look at this, this is the area right here when we look at just one mask and or a double mask, and I'll show you a little slide a little later. But just with the surgical mask, the one that typically you see everybody handing out. I don't know if you can see me on my camera or not, but it's it's the surgical mask right here. It's this mask. Just that mask alone, if both receiver and sender are wearing their face covering, it reduces the chance of spread by 96%. Just that one. And now they're saying if it's knotted. So knotted, why are they saying it's knotted? Because you have to have that close fit to your face. This first picture A right here, that reminds me of my daughter because she has a small face, and when she puts her mask on, it's flopping around over here and it's open there. And so if we look at the C and see that how that fits against the face, that helps to reduce spread by 96%. They also looked at double masking, which is a surgical mask with a cloth mask over that. And I believe that was 96.4%. So you're at 96% just by wearing a properly fitted surgical mask over wearing two masks at a time. Is just a few tenths of a percentage points higher. And here's their data when you look at mask to mask. They looked at no mask to no mask, no mask to mask, mask to no mask, and then both people wearing a mask. And you can see ultimately that this is the knotted tuck medical procedure mask. If we wear that, it keeps everything down to where your chances of contracting this virus is very minimal. So looking at all of the new research that has come out, knowing what we need to do for our students, looking at everything that has been going on and receiving calls from not just students but parents and working with them, we knew that we had an opportunity that we could make sure that our secondary students days were increased and we could do it safely. If we couldn't do it safely, that's really the key. You have to make sure that we're safe and making sure that when you're bringing people back. So we knew we could do it, and moving forward, we think that this is the best thing for our division to make sure that our students are receiving the education that they needed in a safe manner. So what are we doing in the schools? One, we're going to keep the 6 feet. We think we can keep that to 6 feet. Our gold standard is 6 feet. If we do narrow down to under 6 feet, say 4 feet, and I told principals, if it comes to it, don't just automatically drop down to 3 feet. Go 5 feet, 4 feet, but do not go under 3 feet. So what can we do? We have ordered desk shields. We've ordered face shields. We're going to give the ability for people to wear 2 masks if they want. We have purchased sanitizing machines that will be shared between classrooms. So with teacher groups, maybe it's a department or maybe it's a grade level at the elementary. So each elementary grade level will have one of those handheld sprayers that if they want to clean their room outside of the time that our custodial staff is cleaning, comes in and does the cleaning, then those teachers can do that at the middle and high school when they change classes. Those teachers could actually take the time, spray down those desks real quick. It takes about 45 seconds for that stuff to dry, and it's sanitized. So it's a pretty quick, effective way to make sure that you're sanitizing hard surfaces. Increase our just our hygiene, our hand hygiene, making sure that we have stations all around. We do have them, but we're going to increase them. We're going to increase time for um, making sure that students have the time to do the things that they need to do, but do it in a safe manner. So really, it's just one of those things that we knew it was time, that we were able to do it. The downside to it, we had to shift 2 schools from a 9 o'clock start to an 8 o'clock start. And that freed up our buses because we wanted to make sure that our buses, we could fit 1 per seat. And that's the new CDC guidance. You can fit 1 per seat unless it's family. Family, you can put more if you need to. We will continue to make sure that we keep 1 per seat. And if in tough situations, we're not going to leave a student on the side of the road if they're waiting on a bus. But if there is a situation where 2 people have to share a seat, then we will have a face shield that those students could wear for that little short distance. And it's really just all about layers of mitigation. It's how can we continue to move forward, do it safely, and then what other strategies can we put in place to protect? And that's really where we're at right now. We feel confident that we're going to be able to do this. I know we have a large number of our secondary students that have called to say, yes, get me in 4 days a week. So we're going to increase. We're hoping, as I mentioned earlier, I walked in some of those secondary classrooms and you see 3 students. Now, I'm hoping I walk in there and I see at least 12. The capacity of those rooms may be 18, 6 feet apart. But I'm hoping I see 12 or 15 because we know that's the best way for students to learn. And we're just doing the right thing for our kids, for our children, for our community. Because ultimately, some of these, we realize that there are a lot of deficits that we're going to see that you're going to not just, we're going to be seeing it for years to come. There's going to be concepts that students have lost that will be detrimental to them in the long run. And so we just want to make sure that we're doing the right thing for our children and for our community. So I'll stop there. That's kind of where we're at. We're excited about the move. We have that move will take place on the 15th, and we will continue. We're going to heighten our monitoring with when we do have our students come in, but we have a lot of strategies in place. We have done a great job. As I tell everybody, our elementary schools were 4 days a week in the height of the pandemic, when cases were at their highest, when death rates were at their highest, and we did not have a single issue at any of our elementary schools. If we can do it there, we can do it at the middle and the high school as cases are starting to trend down. So I'll take questions now if you'd like.
Thank you, Dr. Ballenger, for the update. I'm sure there probably are questions. Debbie, yes, ma'am.
Dr. Ballenger, my grandson has been attending school at my dining room table since it started back in the fall until last Friday. And his parents agreed to let him start back to school. He wants to be in soccer. So I said, if you want to have the fun and the privilege, you need to pay the price too. And he was excited about going back. And guidance let him start back, like I said, last Friday. And I asked about his day. And he said there was very few students in his class. And one class, he only had one, he was the only student.
Mm-hmm.
So he's looking forward to his friends being back. But I can see a difference in him, in his attitude about going to school and how he progressed through. And it's time for the kids to be back. It really is. So I commend you for moving forward.
Thank you.
Are there other comments or questions? One thing I'm curious about, and I realize this may be a difficult question to answer at this point, but you referenced the deficits that we feel like are there. How do you plan to address those going forward in the short term, in terms of how do you assess those deficits? How do you try to address them starting with the rest of this school year, going into the next school year?
Well, one of the things we're going to have to do is look at increasing or expanding our summer school. As I had some principals, and so we were talking, especially at the secondary level, or at all levels, that some principals said, okay, so if we can close some of our overflow rooms by moving that distance to 4 feet, and if we feel as the principal that we can keep it safe, can we do that to free up a teacher? I said, yes, as long as you put that teacher in remediation. And so some schools are looking at how can we continue to stay safe, but free up personnel to increase remediation that needs to happen within the school system. One of the things we're going to have to look at long term, for instance, we were having a discussion yesterday for some of our students that come from middle school to high school. And typically in a year, you would look at assessments and grades and say, okay, yes, this student can, we know they're going to grasp it. We can put them in the semester algebra 1, but this student needs to go into the year-long algebra 1. So really what we're going to probably do is put all students in the year-long, because we may not be aware of them missing a concept in Math 8.
Right.
And so we want to make sure that those students have every opportunity that entire year to not miss that concept, because algebra is the foundation of every single thing that you're going to take in high school.
Yeah.
And if you miss a concept, or you rush through it, or you miss something within your 8th grade math, then it's going to be tough. But we're looking at what kind of remediation programs we can put together right now. We have also, to help at the middle and high school transition, we're bringing in additional subs that will be there to help support and to provide other things that the principals need. So it may be that, we're bringing in 4 additional subs at each school. They may not be needed to be in the classroom, but then they're going to be working with students individually. So they're going to be doing something to help with remediation.
Thank you. Thank you. Cian, you have your hand up?
Yes, I do. Thank you very much for keeping us all up to date. It's really important, and I really respect what you're doing. I posted a link for a very good article that in the Journal of the American Medical Association that shows evidence that children of every age can safely wear a mask. I thought that might be useful to you at some point. And secondly, what % of your faculty are uptaking the vaccine?
So we're at 65% of our faculty have been fully vaccinated as far as receiving both doses. Oh, hang on a second. I'm hitting the wrong button here. Receiving both doses of either the Pfizer or the Moderna. Now we have a list of another 30 teachers that have now since requested the vaccine. And so I actually have a call with, I believe it's Valley Health this morning, to see how I can work to get those teachers maybe their first shot, or I know the Johnson & Johnson has just came out before March 15th, because they're ready for it now. That, some of the doctors told them to hold off. Some of them might have had some medical conditions, but now the doctors are saying it's okay, go take it.
Yeah, and just yesterday, I think Valley Health opened up a boatload more appointments at the Shenandoah University site. So if they don't mind a little trip, if they hurry up and get online right now, they can probably get in there.
Okay.
A lot more hours and days.
Okay, and thank you for the article. I've downloaded it and I'm going to look through it. So
if you need any interpretation in real English, I'm available.
Thank you, Cian. Any other questions? Jen, yes, ma'am, you're muted.
So I can just give a little real live experience. I have 3 children, an 8th grader, 7th grader, and 5th grader. So I think we've lost my 8th grader. She never wants to go back into the classroom again. She's found her niche and the way to do things online, and she's excelled, straight A's. So I don't know what to do, but they've opted not to go back in. My 7th grader, he's a little more social with his friends, but my 8th grader, the anxiety, I've seen it and I can't believe it. I don't know where it's coming from, but I'm a testament to the children's behaviors, and anxieties have definitely been impacted. Being stuck behind the computer at home alone, going out to Walmart's overwhelming to her. And it might be her age, but it's a challenge. And then the youngest, I just want to also say I'm thankful for the schools. They have offered him tutoring. He has been going the 4 days a week, and he has struggled. He has always struggled in school, and this year it's been even that much harder. So he gets to go on Wednesdays. So the one day that they're not in, he has, I think he said last Wednesday, it was just one-on-one. It was an assistant that was able to help him. He got to go to the elementary school, which he's missed out the whole entire 5th grade. I don't know if everybody realizes that these 5th graders missed their most exciting big kid, year, that you're the head honcho of the school. So he was so excited to go back into LFK and, see the school at least one last time, because he didn't really get to say goodbye. So anyway, they're doing their best. And, I just want everybody to share, my children, so you can see how that kind of fits into everything that was just shared today.
Thank you, Jen. Any other questions, comments? Well, Dr. Ballenger, again, thank you so much for coming back and giving us another update. We really do appreciate hearing what's going on and having the opportunity to ask questions and provide comments. And as you know, our process is we will donate another book in your honor to a local preschool. And Barbara is showing that on the screen. Today's book is called I Like Myself, written by Karen Beaumont and illustrated by David Catro, and it will be presented to the Gear Preschool. So thank you again very, very much for coming back and sharing with us today.
Well, thank you for having me. It's a pleasure to join and to share what we're doing. I know there's always a lot of questions out in the community.
Yeah.
And so, please, if you have any questions, give me a call, stop by the office, or shoot me an email. I'll be happy to walk you through. I'm very open and transparent with what we're doing. We're not, we want to do things right. We want to do it and do it right and for the right reason.
Yeah.
And but yes, and if you have any suggestions, I'm always open. I've never had the best idea. All the ideas come from other people. I just help implement them. So please share, and I'm here to serve you as the superintendent of your community school. And so please don't hesitate to give me a call, and I'd love to come back whenever you're ready, maybe even to lay out our plan for next year. So
I got that on my book.
all right. Sounds great. So thank you so much. I do appreciate your time today.
Sure.
Thank you for coming on the short notice this time.
No problem.
Thank you. All right,
Bye-bye.
Rob, the magic computer, is it geared up and ready to go?
It is indeed. So let me